as I said, I mean, this is interestingly called a disease of theories because nobody knows what exactly is the reason behind that. So one theory is called theory of retrograde menstruation. So as I said, normally the menstrual flow is outside, but somehow in some women, the lining of the womb, when it is shed, it's being shed, some of the deposits and some of the material goes retrogradely and it get deposits within the pelvis, either around the tubes or within the ovaries or in the peritoneum of the pelvis. Uh, and then it responds every month to ovarian hormones. Uh, so every month there is swelling in that deposit, endometriotic deposit. It swells up, it gets inflamed, but because there is no outlet, so the patient gets pain, patient gets irritability, and there's a bit of bleeding inside that deposit, which can lead to chocolate cysts within the ovary, outside in the pelvis sometimes. Um, so yeah, so this is the theory, which is the most common theory. But then endometriotic deposits are seen in lungs or in some other distant sites. So this retrograde menstruation cannot explain that. So some people believe that there is some genetic component in some women because it's in some cases it runs in families as well. So there might be some genetic tendency, which exactly the exact genes people are still studying on that, and the research is going. But yeah, definitely in some cases there is some genetic component and reacting with some environmental factor, which could be any trigger, environmental toxins, something in the beauty products, something like that, some chemicals with genetic interaction can the patients can manifest the symptoms and the disease can progress as well. One other popular theory is also autoimmune, that the body's ability to clear those endometriotic retrograde deposits is impaired because they have seen that in some women retrograde menstruation occurs, but they do not develop endometriosis. So maybe their body clears those deposits quickly compared to those women who have symptoms and their disease progress. So they have some autoimmune problems like other autoimmune diseases like thyroid tissue, like diabetes in some cases. So it's type of autoimmune where the body reacts against its own things, or the body's ability to deal with that endometriotic deposits is impaired as well. So yeah, there are different theories which explain in different cases.